Common medical laboratory tests. Introduction. Medical laboratory tests help doctors diagnose diseases, monitor treatment, and assess a person's overall health. Complete blood count, CBC, measures red blood cells, white blood cells, and platelets. It helps detect anemia, infections, and blood disorders. Blood sugar test measures the amount of glucose in the blood. It is used to diagnose and monitor diabetes. HbA1c test shows the average blood sugar level over the past 2 to 3 months. It helps monitor long-term diabetes control. Liver function test, LFT, checks liver enzymes and proteins. It helps detect liver diseases, infections, and liver damage. Kidney function test, KFT, measures creatinine, urea, and other substances. It helps assess how well the kidneys are working. Lipid profile measures cholesterol and triglycerides. It helps evaluate the risk of heart disease and stroke. Thyroid function test, TFT, measures thyroid hormones such as T3, T4, and thyroid-stimulating hormone. It helps diagnose thyroid disorders. Urine analysis examines urine for cells, proteins, sugar, and bacteria. It helps detect kidney disease, urinary tract infections, and diabetes. Electrolyte test measures sodium, potassium, chloride, and bicarbonate. It helps assess fluid balance, nerve function, and muscle function. C-reactive protein measures inflammation in the body. It helps identify infections and inflammatory diseases. Erythrocyte sedimentation rate measures how quickly red blood cells settle. It is used to detect inflammation and monitor certain diseases. Coagulation tests, PT, INR, evaluate how well blood clots. These tests help diagnose bleeding disorders and monitor blood thinning medications. Blood culture detects bacteria or fungi in the bloodstream. It helps diagnose serious bloodstream infections. Pregnancy test detects the hormone HCG in blood or urine. It is used to confirm pregnancy. D-dimer test measures protein fragments formed when blood clots break down. It helps detect conditions such as deep vein thrombosis, DVT, and pulmonary embolism. Troponin test measures proteins released when the heart muscle is damaged. It is commonly used to diagnose a heart attack. Procalcitonin PCT test measures procalcitonin levels in the blood. It helps identify serious bacterial infections and sepsis. Arterial blood gas measures oxygen, carbon dioxide, and blood pH. It helps assess lung function, breathing problems, and acid-base balance. Cross-matching test checks whether donor blood is compatible with the recipient. It helps prevent transfusion reactions. Serum calcium test measures calcium levels in the blood. It helps evaluate bone health, kidney function, and parathyroid disorders. Uric acid test measures uric acid in the blood. It helps diagnose gout and monitor kidney function. Amylase and lipase test measures enzymes produced by the pancreas. It helps diagnose pancreatitis and other pancreatic disorders. Bilirubin test measures bilirubin levels in the blood. It helps diagnose jaundice, liver disease, and bile duct disorders. Hepatitis panel detects hepatitis virus infections such as hepatitis A, B, and C. It helps diagnose and monitor liver infections. HIV test detects HIV infection. Early diagnosis helps start treatment promptly and reduces the risk of transmission. Dengue test detects dengue virus infection using ENS1 antigen or antibody tests. It helps diagnose dengue fever. Malaria test detects malaria parasites in the blood. It helps confirm malaria and guide treatment. COVID-19 test detects SARS-CoV-2 infection using PCR or rapid antigen tests. It helps diagnose COVID-19. Stool examination examines stool for parasites, bacteria, blood, and digestive problems. It helps diagnose gastrointestinal diseases and infections. Conclusion: each laboratory test has a specific purpose. Together, these tests help doctors diagnose diseases accurately, monitor health, and provide the most appropriate treatment. Like, share, subscribe, and follow Bio Enigma X Javesh for more informative videos.